Hello and welcome to Fill the Gap. I'm so happy to say this after so long because I'm putting a video up after so long. It is because we were blessed with a baby boy. That is why the long break. Yeah, I'm back. I'm hoping that I can post more regularly. So today we'll be doing pharmac. Pharmac is one of my favorite subjects. I know most of you will think pharmac, favorite subject, like, wow, ma'am, how can you even say that? But if you actually study it with the help of mnemonics, diagrams, you can master this subject. So let's dive in. Today's topic is aminoglycosides. Okay, so today let's talk about aminoglycoside. Amino. So we're going to focus on this word, NO. So let's see, what can NO stand for? Okay, so NO stands for no, not absorbed orally. Can you say that? No stands for no oral intake. Okay. Second, it does not cross no crossing blood-brain barrier. Yes. Let me just decrease the size. It's a little too fat. Okay. Next, big no. Aminoglycosides is a big no in pregnancy. No in pregos. Then, NO also stands for needs oxygen. Needs oxygen. Why does aminoglycoside need oxygen? They need oxygen for uptake into the bacterial organism. Okay, their penetration across the cell wall is dependent on oxygen-dependent transport. So they need oxygen. So NO needs oxygen. Next, NO also stands for, no is like a negative word, right? So it's used for negative organism. NO stands for negative organism. So now we are talking about the spectrum. So this acts on infections caused by gram-negative organisms. Negative. Now NO also stands for the toxicities. What are the toxicities? Okay, I think I drew this upside down. 1 minute, let me just erase this. Yeah, I don't know how I just drew that upside down. Okay, sorry, let me just give me a second. Okay, yeah, toxicities. N stands for nephrotoxicity. O stands for ototoxicity. What is nephro? Kidney. Oto, ears. So I'll just draw ear here and 2 kidneys here. Yeah, don't mind the drawing, please. Yeah, N also stands for neuromuscular blockade. Neuromuscular blockade. So this causes so many toxicities. So since it causes neuromuscular blockade, it's not used in patients with myasthenia gravis. Kidney patients, no. Or it's used in a very low dose. Ototoxicity, it can be 2 ways. It can be vestibular or auditory. Okay, so these are the main points. Now, one big main point we haven't covered, that is no protein synthesis mechanism of action. Okay, I don't have any space here, so let me just erase. I hope you guys have taken this down. Don't take screenshot because it will just remain in your phone. You will not look through it. Take your notebook, write it immediately. Yeah, so main point, another no. No protein synthesis. Why no protein synthesis? We'll tell you. This is very interesting because this NO, the word NO covers a lot of things. No protein synthesis. So basically, this is the mechanism of action. How does aminoglycoside stop protein synthesis? So what they do is they bind to the 30S subunit of the ribosome. And this is how they stop the protein synthesis. So they are bactericidal. We've seen drugs like ethambutol, it's bacteriostatic. This is cidal. Cidals are killers. So let me just draw a knife. So everything is negative about aminoglycoside. They are killers. They act on negative organisms. Okay, I'm just writing that this is a knife because my knife doesn't look so good. Okay, so 30S ribosome. It acts on the 30X ribosome and it inhibits the protein synthesis. You can also remember it this way. Aminoglycoside starts with the letter A. A is the first letter of the alphabet, which is the first step in translation. Initiation, however you want to say it. That is the first step. So A is the first letter, aminoglycoside, initiation. So what does it do? Why did I mention this? So aminoglycoside, it stops. Let me take a better color. Stops, and all should be in red. Stops the initiation of translation. They inhibit initiation, which is the first step of translation. How do they stop it? By binding to 30S ribosomes and causing misreading of mRNA. When there is misreading of mRNA, it stops or inhibits the protein synthesis. Okay, and that causes translational errors. Okay, So many things we learned. What did we learn? First, we learned that it cannot be absorbed orally. Yes. Second, just tell me from your memory. See, we all watch so many reels that our memory is gone for a toss. Really. So it's good to use your brain a little sometime. Yeah. So not absorbed or orally. Yes, it cannot be absorbed orally. Next. Fast. No crossing blood-brain barrier. Yes. Next. Okay. No in pregnancy. Then it needs oxygen. It is a negative word, and no is a negative word. It's also a negative organism. So gram-negative organisms. Toxicities: auto, nephro, neuro. Neuro means not neurotoxicity as a neuromuscular blockade. Okay, so now we also need to know what are the drugs that come under aminoglycosides. You need to remember a few at least. So let me just try to help you guys with that. There's an easy way to remember it. Aminoglycoside. So here we need to A for amikacin, then G for gentamicin, S for streptomycin, then let me just see anything else. I'm not able to remember. Yeah, N for neomycin. So from this word itself, we got this many: amikacin, neomycin, genta, strepto. Yeah. Now what I have missed is tobramycin, kanamycin, nitlmycin, fremicetin. Okay, fine. Now, there are some drugs which causes more toxicity than the others, and you might have to remember those. So, nephrotoxicity. What is nephrotoxicity? Yes, kidneys. So, which is a drug among these aminoglycosides which causes maximum nephrotoxicity? Can you guess? Sorry about me. Yeah, nephro. Okay, nephrotoxicity maximum is by neomycin. Now, this neomycin also causes maximum neuromuscular blockade. So what is common? N is common. Neo. Nephro, neuro. That's that. Now comes ototoxicity. What's special about oto? Ototoxicity can be, see, when we talk about ear, there is auditory, canal, and the vestibular. So auditory stands for A. There comes amikacin, maximum toxicity amikacin. Vestibular, it's streptomycin. I don't have a mnemonic for that. Streptomycin. And for, so that's it. So these are the ones that causes the maximum blockade. So I hope you understood this video, and do share my channel. Do share these videos to your friends. So see you all soon with another video from Pharmac. Take care. Bye.